Hi, I'm Dr. Dean Papart. I'd like to thank you for taking a moment to watch this video. Today I'm going to make a video that's going to show shoulder exercises. Many times we get patients who come into the office and they have concerns with their shoulder, whether it's the actual shoulder joint of your arm and your scapula or the clavicle and the scapula. There's different areas of the shoulder that can be a concern at times. And oftentimes I found that not only providing care for the patients through adjustments or therapies helps, but home exercise is big. And today I'm going to go through some of the common exercise on this video that I recommend to my patients. And I want to make this disclaimer. It doesn't necessarily mean it's going to help the condition that you have, but I want you to see these exercises in case you ever come to the office and I recommend a particular exercise and you forget how to do it. You can just refer to the video and you can watch me demonstrating it. So today we're going to be going to do some exercises that are based on a handout that's going to be popping up on your computer as you watch this. There's a little handout that shows the front and back. And I'm going to demonstrate some of the more common ones. I'm not going to go through all of them, but just the more common exercises. The first one is going to be shoulder rolls. So it's pretty easy to do. You're just going to stand and you're going to just roll the shoulders. You're going to be rolling them forward and then you're going to be rolling them backwards. Okay. And again, I'm just doing a little bit of a demonstration. When a patient actually comes to the office, I'm going to tell them specifically how many times I want them to do that particular exercise and how many times per day they ought to do that. The next exercise that we're going to do is a wall walking. So in this case, you're going to find a wall in your home and you're going to be standing so that you're perpendicular to the wall. Assuming that my right shoulder was the exercised shoulder that needs to be exercised, I should say, you're just going to take your fingers and you're going to go up along the wall. And you're going to go up to the point of pain. If you can only go that high and it hurts, you're going to stop. You're not going to continue to force yourself to go higher. And you're going to just restart the exercise and you're going to continue up to the point of pain and then you're going to stop. And I'm going to go one more time here. And why are we doing the wall walking? You'll notice that I'm using muscles in the lower part of my arm to elevate the shoulder. So in a sense, I'm not even using the shoulder muscles. I'm just using the arm to elevate the shoulder and get a little bit of motion into this joint passively. We're going to do a few exercises with you perpendicular, and now I'm going to actually face the wall and we're going to be parallel to the wall. And it's a similar type of an exercise. We're going to just put our fingers against the wall and we're going to walk to the point that we can tolerate it. If that's as high as you can go, then you're going to stop right there and you're going to go down again and you're just going to walk up the wall. All right, I think you get the idea. That's the wall walking exercise. The next exercise that I'm going to recommend is going to be using a weight. In this case, I have a 10-pound kettlebell. And what I like to recommend is get a surface that's firm, maybe if you have a desk handy or a kitchen table, and you're going to just support yourself with the unaffected shoulder. And with the affected one, you're just going to make some circles. You're going to start out small, and then you're going to get bigger. Now, if you don't have a kettlebell like I do, you can use any other household item. You can use a can of tomato juice, you can use a half gallon of milk or orange juice, whatever you have that's going to provide just a little bit of traction on the arm. That's going to help pull this joint out just a little bit as we're doing some exercise. So that's the kettlebell with the rolling the shoulder in circles. The next exercise I'm going to demonstrate, you're going to be into the corner of a room and you're going to put your hands above your head here with your fingers interlocked. Now for patients who just have a brand new shoulder issue, probably you're not going to be able to get in this position very comfortably. But for those patients who come in and they're improving and they're ready to get to this exercise, it's a great exercise. You're going to just put your elbows against each wall and you're going to use the muscles of your arm to come forward. And then you're going to go backward and then forward and backward and forward. So this is a good exercise for both the shoulders. You can do both the affected and the unaffected shoulder. And the last exercise I'm going to demonstrate is merely just putting the arms in a plane, and we're just going to lift them up. You're going to go up to the point that it hurts. If it gets to be too painful as you lift, you're going to stop, and then you're going to go down. And then you're going to lift up and down. And with this exercise, you should find if you start doing this over several days, you should be able to go higher and higher. You should be able to actually get the arms to touch if you're limber. And that's going to be the last exercise that we're going to demonstrate. So just to recap, these exercises are great exercises for many different conditions. Whether you have like a shoulder that's locked up, like a frozen shoulder, or if you have maybe a tendonitis or bursitis, or even just a slight misalignment of the shoulder joint, these are excellent exercises to try. This is not the only set of exercises that can be done, but this is a great set that usually helps most of my patients. All right, that's going to conclude this video for right now. I'd encourage you, if you do have a shoulder issue, go see your primary doctor if it's not getting any better. And if we can be of service to you, please don't hesitate to call us. You can call the office at 714-821-4265. I'm Dr. Dean Peppard, and I thank you very much for watching.